FDA recently issued a notification to healthcare professionals warning about the possibility of serious injury if patients with implanted neurological stimulators undergo MRI exams. The injuries reported to the FDA have included coma and permanent neurological damage. They were likely caused by heating of the electrodes at the tip of the leads.
Didn't we talk about similar injuries that occurred in patients with these implants when they underwent diathermy treatment?
Yeah, about 2 years ago, we did a story about patients with these neurological implants getting diathermy and having serious injury. In fact, 2 patients with deep brain stimulators died as a result of getting diathermy. And now with MRI, which is used a lot more than diathermy, the chances for injury are that much greater.
So patients getting these stimulators ought to be cautioned about getting MRI exams.
Yeah, the FDA notification warns that physicians who either implant these stimulators or monitor patients who have them should warn patients that if an MRI procedure is prescribed, they should check back with a monitoring physician and make sure, in fact, that they can be performed safely. Health professionals should remember that a fairly wide variety of products are neurological stimulators. They include neuromuscular stimulators and also those designed to stimulate the deep brain, the spinal cord, the vagus nerve, and peripheral nerves.
But let's say a patient with one of these stimulators fails to check back with the physician. Presumably the radiologist office is the second line of defense.
A very important line of defense. And so the FDA notification, the basic thing it says to radiology personnel is be sure to screen patients for the presence of implants before you do an MRI exam. If the patient does have an implanted neurological stimulator, then consider consulting with the referring physician about other imaging options. Now, if it's decided that an MRI procedure is indicated, be sure to review the labeling for the specific model stimulator and pay particular attention to warnings and precautions. For some stimulators, the labeling may specify the types or strengths of MRI equipment that can be used. But with other stimulators, certain MRI procedures simply cannot be performed.
But once a patient has had his implant removed, this isn't an issue any longer.
That's not necessarily the case, because sometimes an implant is removed, they take out the pulse generator, but the leads remain in place in the patient. Those leads can be heated by the MRI and cause a problem as well. So it's important not just to ask about present implants, but ask the patient whether they've had implants in the past. Go to our website and you can see the complete FDA notification.